Hello and welcome to my channel. In this video we will discuss about bipolar disorder. And the basic topics that we will cover in this video are: what is bipolar disorder, what is the basic etiology, that is what are the basic causes that leads to bipolar disorder. The next we'll talk about the various types of bipolar disorder. And after that we will discuss about the clinical features, that is what are the signs and symptoms of bipolar disorder. And then next, very important, we'll talk about the investigation, that what are the diagnoses for bipolar disorder. And at last we will talk about the natural homemade remedies, or the natural treatment that you can try if you are suffering from bipolar disorder, if you don't want to take allopathic or any type of medicines. So these are the basic topics that we will cover in this video. So let's start. So first of all, we'll talk about what exactly is the meaning of bipolar disorder. So bipolar disorder is a mental illness that is marked by extreme shift in the mood, or simply you can say mood swings. And the symptoms can include an extremely elevated mood called mania. And they can also include episodes of depression. And bipolar disorder is also known as bipolar disease or maniac depression. So this is the exact meaning of bipolar disorder. The next, now what are the causes, and or you can say what are the etiologies that leads to bipolar disorder. So let's talk about the causes now. So as we all know that, as I have already said, bipolar disorder is a common mental health disorder. So it's a bit of a mystery for the doctors and the researchers, and it is not yet clear that what exactly is the main cause that people develop this kind of condition. But the possible causes of bipolar disorders include: first, genetics. So let's talk about this cause, that how genetics is correlated with bipolar disorder. So if your parents or your sibling has bipolar disorder, so you are more likely than other people to develop this condition. And it's very important to keep in mind that most people who have bipolar disorder in their family history do not develop it. This is the first cause, that is genetics. Now second cause of bipolar disorder is your brain. So your brain structure may impact your risk for the diseases. Abnormalities in the structure or the functions of your brain may increase your risk to bipolar disorder. Now third cause is environmental factors. So it's not just what is in your body that can make you more likely to develop bipolar disorder, but outside factors may also contribute to bipolar disorders, and these factors can include extreme stress, secondly, traumatic experiences, and thirdly, physical illnesses. So these are some environmental factors that leads to bipolar disorder. So these are the various causes of bipolar disorder. Now next we'll talk about what are the classification, or simply you can say what are the types of bipolar disorder. So basically there are three main types of bipolar disorder, that is bipolar 1, bipolar 2 and cyclothymia. So first of all we'll talk about bipolar 1 disorder. So let's talk about it. Of bipolar disorder affects the men and women's equally. Okay, so this is bipolar 1. Now we'll talk about the second type of bipolar disorder, that is bipolar 2. So people with this type of bipolar disorder experiences one major depressive episodes that they have also they have also at least one hypomaniac episode that lasts about 4 days. And this type of bipolar disorder is thought to be more common especially in women's. Now, third type of bipolar disorder is cyclothymia. Now, what is cyclothymia? So people with this, that is cyclothymia, have episodes of hypomaniac as well as depression. It is a combination of bipolar 1 and bipolar 2 disorder. And these symptoms are shorter and less severe than the maniac and the depression, which is caused by bipolar 1 and bipolar 2 disorders. And most of the people with this condition only experiences a month or 2 at a time where their moods are stable. So this is the broadly classification of bipolar disorder. I hope this is very much clear to you guys. Now move to next. Next we'll talk about the very important, that is clinical features, that is what are the signs and symptoms of bipolar disorder. So let's talk about the symptoms now. So mainly there are 3 main symptoms that can occur with bipolar disorder. They are mania, hypomania and depression. Now one by one in elaborated manner we will discuss these symptoms with you guys. So first of all, mania. So while experiences mania, a person with bipolar disorder may feel an emotional high. They can feel excited, impulsive, euphoric, and full of energy. And during maniac episodes, they may also engage in behavior such as drug use, spending sprees. This is the first symptom, that is mania. Now let's talk about the second symptom, that is hypomaniac. So hypomaniac is generally associated with bipolar 2 disorder, and it is similar to the mania, but it's not as severe. Unlike mania, hypomania may not result in any trouble at work, school or social relationships. However, people with hypomaniac still notice changes in their mood, that is hypomania. Now let's talk about the third symptom, that is depression. So during an episode of depression, one can experience first deep sadness, second hopelessness, third loss of energy, third lack of interest in activities they once enjoyed, fourth periods or too little or too much sleep, and last one is suicidal thoughts. So these are the various clinical features, or you can say signs and symptoms of bipolar disorder. Now very important that we will discuss with you is what are the symptoms of bipolar disorders in case of females, in case of women. Okay, so men and women can diagnosed with bipolar disorders in equal numbers. However, the main symptoms of the disorder may be different between the two genders, and in many cases a woman with a bipolar disorder may have, that is, to be diagnosed later in life in her 20s or 30s. Secondly, have milder episodes of mania. Thirdly, that can be experience more depressive episodes than maniac episodes. Next, can have 4 or more episodes of mania and depression in a year, which is called as rapid cycling. Next, they can experience other conditions at the same time, including thyroid disease, obesity, anxiety disorders, and migraines. They have a higher lifetime risk of alcohol use disorder. So women with a bipolar disorder may also relapse more often, and this is believed to be caused by hormonal changes related to menstruation, pregnancy, and menopause. So these are the signs and symptoms that you can observe in case of females, that is bipolar disorder. Now, secondly, what are the signs and symptoms of bipolar disorders in case of males? So, as I have already said, that men and women both experience common symptoms of bipolar disorders, but men may experience symptoms which are differently than women. So, men with bipolar disorders may feel, that is, to be diagnosed earlier in their life. Next, they can experience more episodes, especially the manic episodes. Thirdly, they can have substance abuse issues like alcohol. Next, act out during manic episodes. So these are some signs and symptoms that you can observe in case of males. Now next, very important. What are the signs and symptoms of bipolar disorder in case of teenagers? So this is very important. So let's talk about it. Think new to the average parents of a teenager. So the shift is hormones plus the life changes that come with puberty can make even the most well-behaved teen seems a little upset or overly emotional from time to time. So, a bipolar disorder diagnosis is most common during the late teenagers and early adult years. So, for teenagers, the more common symptoms of maniac episodes include being very happy. Next, acting out or misbehaving. Thirdly, taking part in risky behaviors. Fourth, abusing substances like alcohol, drugs. Next, thinking about the erotic things more than usual. Having trouble sleeping but not showing signs of fatigue or being tired. Have a very short temper. Having trouble stay focused or being easily distracted. So for teenagers, the most common symptoms of a depressive episodes include sleeping a lot or too little, eating too much or too little. Next, feeling very sad and showing little excitability. Next, withdrawing from activities and friends and like to be alone. And the last one is thinking about the death and suicide. So these are some signs and symptoms that you can observe in case of teenagers. So this was all about the clinical features, that is, what are the signs and symptoms of bipolar disorders in case of males, in case of females, and in case of teenagers. Now let's talk about the very important part, that is investigations, that how you can investigate that you are suffering from this disorder, that is bipolar disorder. So what are the investigations that you can perform? So let's talk about the diagnostic examination. So your doctor will do a full physical examination. They may also order blood or the urine test to rule out other possible causes of your symptoms. Second diagnosis is due to a mental health professional such as psychologist or psychiatrist. These doctors diagnose and treat mental health conditions such as bipolar disorder. And during the visit, they will evaluate your mental health and looks for the signs of bipolar disorder. The third investigation is mood generals. So if your doctor suspects your behavior changes are the result of a mood disorder like bipolar, so they may ask you to chart your moods. The easiest way is keep a journal of how you are feeling and how long these feelings last. So your doctor may also suggest that you record your sleeping and eating patterns. Now next investigation is, and that is the last one, diagnostic criteria. So the diagnostic and the statistical manuals of mental disorder, that is DSM, is an outline of the symptoms for various mental health disorders. Your doctor can follow this list to confirm a bipolar diagnosis. So these are the various investigations and the diagnostic criteria that is very useful in order to know that if you are suffering from bipolar disorder or not. Now next we'll talk about what are the natural remedies for bipolar disorder. Helpful for bipolar disorder. However, it's important not to use these remedies without first talking with your doctor. These treatments could interfere with the medications you are taking. So the following herbs and the supplements may help stabilize your mood and relieve symptoms of bipolar disorder. So first natural remedy is fish oil. Or simply you can say omega-3 fatty acid. So fish oil shows that people who consume a lot of fish and fish oil are less likely to develop bipolar disease. You can eat more fish to get the oil naturally, or you can take over-the-counter supplements. Next natural remedy is Rhodiola rosea. So this is very helpful for the treatment of moderate depression. It may help treat depressive symptoms of the bipolar disorder. So that's all in this video. We have discussed about the bipolar disorder, what are the signs and symptoms, what are the causes, what are investigations, and what are the clinical features of bipolar disorder, what are the natural remedies that you can try for bipolar disorder. So that's all for today. See you guys in our next video, that is how one can manage bipolar disorder by using homeopathic medicines. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy, and yes, thanks for watching this video.